You are an FI1 in Paediatrics, the specialty you are intending eventually to train in. Your next rotation, which starts next month, is in cardiology. This will include being part of the arrest team that is called to all adult cardiac arrests in the hospital. You have received basic life support training in medical school but have not yet attended any postgraduate courses on resuscitation. You are considering your current training priorities. Rank in order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Don't use your days off for training, just get some rest. Study leave is available in FI2, so training can wait until then. B. Use a day off during the next month to attend a course on pediatric life support. C. Use a day off to attend a revision course for the Royal College of Paediatrics and Child Health Part 1 exam. D. Use 2 days off during the next month to attend a course on Adult Advanced Life Support, ALS. E. Wait until the next rotation, then arrange time off to attend an ALS course. Answer D, E, B, C, A. It is important to choose training based on skills you need to develop, not just based on what you enjoy or find interesting. You will soon be in a position where you need good adult resuscitation skills. The options which include attending an ALS course therefore rank higher than options which do not. Option D is therefore the best response because it is better to be prepared ahead of starting the job. If you wait to organize training until starting cardiology, E, you will have to attend arrests prior to the course, when you may not be fully competent. Although your career path is focused on pediatrics, it is not a priority at this point in terms of competence. However, option B is better than C because it concerns resuscitation and therefore may include some transferable skills. Option A is the worst option because it involves not taking responsibility for your training needs. Sometimes it is necessary to use your time off for training in order to maintain your competence. You are working on the general surgical ward, looking after a patient who is 2 days post-op after a laparoscopic cholecystectomy. Ever since the operation they have been in pain, and on your examination this morning, they exhibited signs of peritonitis with tenderness and guarding in the right upper quadrant. You are worried that this may be a complication of the surgery and look back at the operation notes. There is no mention of any complications. However, you notice that the primary surgeon was a junior registrar. You ask this registrar for advice, and they decide to take the patient back to theatre as, during the operation, they suspected that they may have damaged the common bile duct but didn't want to admit this to the consultant or patient at the time. They ask you not to tell anyone about this. Choose the 3 most appropriate actions to take in this situation. A. Agree to do as the registrar asks as they are more senior than you and you do not wish to challenge them. B. Ask the registrar to discuss the matter with the consultant and explain the need to return the patient to theatre. C. Ask the registrar to explain the problem to the patient as they have a right to know about the potential complication from their previous surgery. D. Discuss this at your next educational supervision meeting to find out how you could have handled the situation differently. E. Discuss this with the consultant, explaining the reason for returning the patient to theatre as this will need to be taken up at a morbidity and mortality meeting. F. Discuss this with the registrar's educational supervisor as perhaps they are performing theatre procedures too advanced for them. G. Explain to the patient that they need to go back to theatre due to an unforeseen complication with the surgery, not mentioning the mistake by the registrar. H. Go and see the patient before the operation and explain to them that the need to go back to theatre was due to a mistake made by the regist. Answer B, C, E. Part of being a competent doctor is being able to admit when you have made a mistake, both to your colleagues and to the patient. In this case, the mistake was not made by you, therefore you should urge the registrar to own up to the mistake, options B and C, rather than informing others about it yourself. However, if the registrar does not wish to own up to their mistake, then option E is appropriate as the consultant should be made aware of what happened in the theatre since the overriding responsibility for the patient lies with them, and the case will likely need to be brought up at a morbidity and mortality meeting. Option A is not appropriate as someone needs to be made aware of the mistake, particularly the patient. While discussing the case with your educational supervisor, D, would be a good idea, this will not lead to an improved outcome for the patient. Going over the registrar's head to their supervisor, F, is not a good idea, especially if you are questioning their abilities when you were junior to them and were not present at the initial operation. Options G and H are not appropriate responses as the mistake is not yours to explain, and placing blame on the registrar in front of the patient will increase the likelihood of legal action being taken. As an FI1, you are also not qualified to perform this procedure, and therefore are not the correct person to counsel the patient on this matter.